Mr. Chairman. You correctly stated our working relationship, and particularly on this caucus over a long period of time that I've served on it, whether Republicans have been in the majority or Democrats in the majority, there has been a strong bipartisanship, and there ought to be, and it's easy here. So I look forward to continuing our relationship now that you have become chairman. Also, I welcome all of our witnesses today, as I had a chance to say hello to you in the anteroom. 93,000, that's a number of how many people died from drug overdoses last year. This is the sharpest annual increase in 30 years. The New York Times wrote that 2020's overdose death numbers eclipsed the peak yearly deaths from car crashes, gun violence, and AIDS epidemic altogether. That ought to be an astonishing figure for all of us to consider. No region was spared last year. Every corner of the United States suffered an increased death toll. The main culprits, COVID-19 and deadly fentanyl analogs. So today's hearing is timely because it's urgent that we evaluate our federal approach on the drug crisis. COVID-19 played a significant role in the increased drug overdose rates. The pandemic brought about a social isolation trauma, job losses, made necessary tools like access to treatment even more difficult. Data shows us that overdoses took off in March 2020 when the pandemic-driven shutdowns and physical distancing measures all began. We must learn how to navigate drug policy in a post-COVID world. What lessons did we learn? How can we improve? These are questions that I want answered. Also, fentanyl analogs are driving up the death toll. According to Customs and Border Patrol, the amount of fentanyl and analogs seized so far this fiscal year nearly doubles what was seized in all of 2020. This statistic alone should be enough to compel serious long-term actions on controlling deadly fentanyl-related substances. Drug dealers often mix fentanyl with other drugs like meth, cocaine, and marijuana. Traffickers prey on those suffering with addiction by adding deadly analogs to other drugs. Sometimes users know what they're consuming, that they're consuming a fentanyl substance, but sometimes they don't know that. In any event, the data speaks for itself. Polydrug abuse, mainly due to fentanyl substances, is a driver of overdose deaths. So at a time of record drug abuse and deaths, where should our priorities be? I recently outlined in a letter to the Office of National Drug Control Policy, which I think must be prioritized in federal approach to drug policy. Among others, I highlighted the need to build a plan to deal with historic levels of methamphetamine supply and use, that we need to address polysubstance trafficking, and we must proactively address fentanyl analogs. The authority to schedule fentanyl substances expires in October. The administration must support efforts to proactively and permanently schedule fentanyl analogs. To do anything less will surely enable the spread of these deadly drugs. I'm grateful that Acting Director LaBelle invited me to weigh in on the National Drug Control Strategy, and I'm pleased to have her testimony today. We must work together in a whole of government approach to assess gaps in policy so we can tackle the crisis. Simply put, it's a matter of life and death. 93,000 Iowans or Americans lost their lives last year because of the rampant scourge of drugs in our country. I hope we all agree that this must end. Thank you again for today's witnesses for being here. I look forward to hearing about how we can work together to strengthen our approach and combat this problem.